channel Bone Education.
Hello and welcome to our channel Bone Education. Today I will show you the most common errors of the DXA scans of the spine and what causes them. I hope you find this one interesting. Let's begin. The first type of errors that I will show you are due to the incorrect positioning of the patient. The spine should be centered in a straight line in the middle of the table. The legs should be placed on a positioning block with knees bent in order to compensate for the lumbar lordosis and the tilting of the pelvis. Improper positioning can lead to rotation of the spine, giving you false results with lower bone density, and therefore you could receive a more serious diagnosis. The second type of errors can be caused by the device itself. If the difference of two DXA scan results is less than 2.8%, it is considered normal. This difference is defined as a coefficient of possible error and is abbreviated LSC, which stands for least significant change. If you repeat the examination and the bone density differs less than 2.8% compared to your previous examination, there isn't any improvement or worsening, but rather a lack of change in your result. Another type of DXA errors are caused by the patient. During the scan, the patient should not move. Any movement can lead to artifacts which could cause bone density higher than the actual one and result in an incorrect report of normal bone density. Other conditions leading to falsely increased bone density are vertebral spars or so-called osteophytes, scoliosis, calcification of the aorta, calcifying chronic pancreatitis, as well as gallstones and kidney stones. Soft tissue mineralization in calcifying chronic pancreatitis may result in falsely elevated bone density despite the lack of overlap with the lumbar vertebrae. Fractures of the spine lead to asymmetry and subsequently to calcification and to the formation of spondylophytes, which can significantly increase the bone density of the corresponding vertebra. Fractured vertebra should be excluded from the analysis. If the patient has had an operation of the spine, such as spinal fusion with hardware placed in the examined area, this vertebrae should be excluded from the analysis too. If only one vertebra remains after the exclusion, then the result is invalid and it is better to perform a hip DXA scan. Rare bone disorders such as Paget's disease can result in increased new bone formation as a result of prior excessive bone resorption. The bones become very large and show an unrealistically high bone density on the DXA scan, when in fact they are weak and fragile. If you had an imaging study with contrast media, be aware that it could also lead to increased bone density. You will need to wait 3 weeks for the contrast agent to get cleared before performing a DXA scan. Silicone implants in your chest are another potential threat to the accuracy of the DXA scans, resulting in a higher bone density of your spine than you actually have. In such cases, the total body DXA examination used to evaluate the result of your fitness training by measuring body composition may indicate a lower bone fat percentage than the actual one. The last type of DXA errors are caused by the operator. After performing the examination, in addition to the obtained values, the device also provides an image of the spine. It cannot be used for X-ray diagnostics, but this does not mean that it should not be looked at the operator at all. In fact, he or she is the one who has to do the necessary corrections and give you a valid result. It is crucial for the final diagnosis. How do you know if your scan is accurate? If your examination was done correctly, the image should show from bottom to top the crests of both iliac bones, half of the fifth lumbar vertebra, the remaining lumbar vertebra, half of the 12th thoracic vertebra, and the last 14 rib. The spine should not be tilted. Of course, in some cases, this is impossible, for example, in patients with severe scoliosis. In this case, the operator should adjust the region of interest. What is the region of interest? In DXA scan, the region of interest is formed by the intervertebral lines and the lateral contours of the vertebrae. In the case of a scoliosis, for example, the operator has to correct the intervertebral lines by adjusting them to the scoliosis angle. Regarding spurs, the operator has to correct the lateral outline of the vertebra with spurs, for example, to exclude the area with spurs from the region of interest used for the bone density assessment. Another indicator that your scan was done right is an increase in bone mineral density, BMD, from the first to the fourth lumbar vertebrae. If a separate vertebra significantly deviates from this trend, it should be excluded from the analysis. Situations where certain vertebrae are excluded from the overall DXA analysis exist, especially in severe spurs, scoliosis, fractures, Paget's disease, as well as spinal instrumentation. Keep in mind that an overall DXA result based on only one vertebra is invalid. If you found this video useful, like it and subscribe to our channel. Stay tuned for our next video, in which we will explain the most common errors in hip DXA scan. Thanks for watching and see you soon!